Hi, Dr. Verschone here with an update on vaccine transportation guidance in accordance with the U.S. Pharmacopoeia Vaccine Handling Toolkit. Providers are now allowed to transport vaccine after the vial is punctured, as long as travel time is not past the beyond use date and within the go time of that vial. Now, what does go time mean? So that's 6 hours from puncture for Moderna vaccine and 6 hours after the vaccine is mixed for Pfizer. There are also some changes to recommendations around temperature monitoring guidance during transport. Most digital data loggers, or DDLs, display minimum and maximum temperatures. If this is true for your DDL, now you are only required to record the time and min-max temperatures at the start of transport, every time the storage container is opened, and when the transport is completed. However, to ensure proper temperature monitoring during transport, if your DDL does not record min and max temperatures, you must still record temperatures hourly. So let's review some best practices when transporting mRNA vaccines. Number 1, protect vaccines as much as possible from drops, shocks, and vibration. To minimize movement, transport in the carton whenever possible. If you're taking small amounts, secure those storage containers during transport in the passenger side of a vehicle, not in the trunk. And number 2, if individual vials are transported, vials should be placed with a padding material like bubble wrap. Number 3, store vaccine vials upright whenever possible. Let's review specifics of transporting unpunctured Moderna vaccine vials. So while Moderna vaccine can be stored refrigerated for up to 30 days, frozen transport between -15 and -25 degrees Celsius or -13 and 5 degrees Fahrenheit is preferred. Moderna can undergo up to 12 cumulative hours of refrigerated transport between 2 and 8 degrees Celsius. That's 36 to 46 degrees Fahrenheit. Take care to ensure vaccine does not refreeze. This is true for Pfizer as well. The Beyond Use date labels are available at Moderna COVID-19 vaccine information on the CDC website. And they have been updated to include transport time. Now we're going to go over instructions on transporting punctured Moderna vials. Once punctured, the vaccine must be administered within 6 hours. Transport punctured vials between 2 and 8 degrees Celsius, or 36 to 46 degrees Fahrenheit. Time used for transport counts as part of that 6-hour time limit. So any vaccine remaining after the 6 hours must be discarded. CDC advises transporting the whole punctured vial in a plastic bag rather than pre-drawn syringes. Remember not to recap the vials because the vial septum or stopper is designed specially to prevent leakage as long as providers are inserting the needle into various locations of the vial septum. This habit can reduce leakage of vaccine and maximizes the doses withdrawn. Now let's talk about the transport of unpunctured Pfizer vials. Pfizer requires ultra-cold transport between -80 and -60 degrees Celsius, or -117 and -76 degrees Fahrenheit. Only full upright trays of vaccine may be transported. Temperature monitoring must be done in a thermal shipping container with a controllant temperature monitoring device or a portable ultra-cold freezer using a DDL with a probe designed to measure ultra-cold temperatures. If you are transporting individual unpunctured Pfizer vials or partially filled trays, it is recommended to transport them refrigerated. They have thawed to that temperature, 2 to 8 degrees Celsius or 36 to 46 degrees Fahrenheit. But remember that they can only be used for 5 days or 120 hours, and any time used in transport counts towards the 120 hours. For punctured Pfizer vials, transport these vials between 2 to 8 degrees Celsius. Take care to ensure vaccine doses do not refreeze. Once mixed, the vaccine must be used within 6 hours. Time used for transport counts as part of the 6-hour time limit. And any vaccine remaining after the 6 hours, just like Moderna, must be discarded. So as stated previously, CDC recommends transporting vaccine in vials. However, there may be instances when the only option is to transport vaccine in a pre-drawn syringe. U.S. Pharmacopeia includes guidance for labeling and packaging pre-drawn syringes in the USP COVID-19 Vaccine Toolkit, Operational Considerations for Healthcare Practitioners. You should consider transporting small numbers of pre-drawn syringes only if they can be monitored closely during transport to ensure that no vaccine is lost by bumping the stopper of the syringe. Pre-drawn syringes can be stored either in the refrigerator at 2 to 8 degrees Celsius, 36 to 48 degrees Fahrenheit, or ambient room temperature, which is 15 to 25 degrees Celsius, or 59 to 77 degrees Fahrenheit. But they must be administered within 6 hours of the first time the source vial is punctured. For Pfizer vaccine pre-drawn syringes, those can be stored for 6 hours at 2 to 25 degrees Celsius, or 36 to 77 degrees Fahrenheit, after the vaccine is mixed. Labeling is very important here. Label both pre-drawn syringes and the container they come in, like a resealable plastic bag, used to hold the syringes, with the items shown here. Remember to follow temporary storage container and temperature monitoring guidance to maintain that cold chain. This kind of update to vaccine handling supports non-traditional vaccination opportunities, which we love here. This is what we need right now to get vaccine to our most vulnerable Chicagoans. So consider this method, in particular for homebound seniors or people with disabilities. Thank you for helping turn vaccines into vaccinations across Chicago. See you soon.